Listen, we have obviously the saying that a stitch in time saves nine. And that's there for a good reason, because frankly, you develop a psychosis that fundamentally takes you out of your reality. If not treated, it has huge implications for, your recovery. Mental health and illness is a continuum, right? On one end of that continuum is wellness. So your five senses does get impacted when you're experiencing a psychosis, and you do have things called hallucinations.
Hi everyone, welcome to Wisdom for Exploit. I am your host, Bola Amore. Today I have an amazing guest with me. Her name is Henrietta, and she is the head of education portfolio at NHS England and a mental health nurse. The subject of our discussion is early detection and intervention in psychosis. Before my guest tells us about herself in detail, please do not forget to subscribe to our channel and click the notification bell to be notified whenever we upload new videos. Over to you, my guest. Please tell us more about yourself.
Thank you so much for having me. So as you said, I'm Henrietta Bankers. I am currently head of portfolio at NHS England, but also a registered mental health. And I have been a registered mental health for the last 22 years. And I started my career on acute wards, and acute wards means when people are suffering from various illnesses, including psychosis, and at the time is working with adults. But my specialist area has been very much working with young people from 16 to 25-year-olds and looking at early detection and early intervention of psychosis. Now, outside of that, I sit on 3 different boards advising on education, but also have had, my career has spanned across digital health service delivery, policy, and education. And I have a huge love for education and making sure that actually we build the foundations that really supports us to create wealth. For me, to be able to create that wealth, you need good education and good health. And so those are the 2 areas that I tend to focus my work on.
Wonderful. Thank you so much for honoring this call. Yeah, as I said, the theme of our discussion today is early detection and intervention in psychosis. And we'll be exploring a topic growing important in mental health care. Early detection and intervention in psychosis. Psychosis frequently appear during adolescents or young adults. Recognizing it sooner improves the chance of minimizing its effects on individual, families, and community. Timely intervention not only improve recovery outcome, but also preserve education, employment, and social relationship. Today, we'll be discussing why early identification matters, the strategy being used to detect warning signs, and how effective interventions can change the trajectory of someone's life. So to you, my guest, my introduction question for you is, why did you choose a career in nursing and majorly focus on mental health?
Really interesting question. I always say to people, actually, I am a disappointed doctor because originally I wanted to pursue medicine, but that did not end up being the thing that I did. But outside of that, I chose nursing, and particularly mental health, because when I was growing up, I found that a lot of people will come to me with all sorts of problems, even adults, and people that were a lot older than me. And it made me ask myself, what was it that made people come to me with their problems? So the more as I was growing up, I thought, actually, if I couldn't be a doctor and I'm going to work in health, then mental health was an area that I wanted to focus my career in. But once I started my mental health career, the areas that I started becoming more and more interested in were a couple. The first being parental mental health. So I did a lot of work around parents who develop mental health problems and how we can support parents to be able to do their parenting work, because let's face it, we're all parents, and sometimes we know that actually parenting is one of the hardest jobs and can impact on your mental health. And similarly, if a child has mental health problems, then it can impact on you as an adult. So that's an area that I was particularly interested in and was able to do some work around that. I mean, I did my dissertations in those for both my first and second degree. But whilst I was doing that, I then became more and more interested in young people's mental health. And for all the reasons that I have stated earlier, because these are their formative years. And if we don't maintain their mental health or their health overall, then it has huge implications for their life. So yes, I spent my last 5 to 6 years as a practitioner doing early detection and early intervention of psychosis and working with schools, universities, and communities to really detect early.
Wonderful. Wonderful. You have a lot in your hand. Well done. Thank you for that. So what does psychosis really mean for someone experiencing it?
So if you are experiencing psychosis, I mean, listen, it's something that is very difficult to explain for the person that's experiencing it. They do know something is not right. For most, they would have lost touch with reality. So their reality is different to the reality that you and I have. So, I mean, obviously, we'll be looking at symptoms later. But certainly for the person experiencing it, the only thing that I am sure, and I have had people who've suffered psychosis, and they tell me, listen, I know something is wrong with me because I'm having all these strange experiences. So when we come to talk about the symptoms, I'll go into a bit more detail about some of the indications that somebody who is experiencing it will have that tells them something is not right with them in their health or in the way that they are seeing things, as in the perceptions that they have, or in the way that they are behaving, in the way that they are feeling. So it does have implications for the person that's experiencing it, but it is almost always difficult for them to be able to articulate what it is that they're experiencing or what it means for them.
Wow, thank you. So could you explain the significance of identifying the early warning signs of this situation?
Listen, we have obviously the saying that a stitch in time saves 9. And that's there for a good reason, because frankly, the earlier you can detect it. So obviously you're looking at the early onset of psychosis, and the fact that you've already alluded to the fact that it tends to happen in people's adolescent ages. Now, if we think about those ages around, it can happen slightly earlier. There are, young children as young as 8 that experience psychosis. It can be as young as that, but predominantly it's in that adolescent phase. And usually those are the times where people are forming their relationships. They're starting to think about their future. They are looking at various, formal exams and everything else that's happening around them, family, environment, and the rest. So if at that time you develop a psychosis that fundamentally takes you out of your reality, if not treated, it has huge implications for your recovery, because left untreated too long, it has huge implications. By that point, you're probably isolated, you've lost your friends, you don't want to go back to the school that you were in. All sorts will happen between that time. So I think it's so important identifying that early warning signs and be able to manage it quickly and get the supporting, because it really can make a difference between somebody's trajectory and outcomes, especially for young people, as soon as you can support them.
Okay, I want to ask this question. I've seen some children that have been bullied, and because of the effect of that bully, they withdrawn. They don't want to go to school, or they feel scared to do things, even sometimes it helped them to end up having this social anxiety. So now, because you mentioned something that now they don't want to go to school with these signs of psychosis and all that stuff, like this bully issue, could it lead to the psychosis?
So I wouldn't say a bullying issue can, there isn't any, what do you call it, direct correlation to being bullied and having psychosis, right? But if you look at, so I will prefix this by saying that mental health and illness is a continuum, right?
Okay.
On one end of that continuum is wellness. And, you know, the absence of illness is you being well. Now, at the very end of that, frankly, I don't know anybody that's at the very end of that spectrum, because we all have stresses in life, school, work, and everything. So we're all, you know, hovering around the wellness, but not quite on the very mark of wellness, because, listen, we all have the stresses. Right at the end of that continuum is, you know, your psychosis or serious mental health problems. And then, of course, you've got the middle, where sometimes people jump from the wellness section into becoming unwell. And the first part of becoming unwell sometimes could be like mild depression or something, withdrawal, things like that. And as you go up the spectrum, then it becomes serious mental health problems. Now, if somebody is being bullied, obviously it has implications for their mood, sadness, and, you know, stress and anxiety and all of those things. But it is real. It is the experiencing this as something that's real and something, a reaction to something that's traumatic.
Okay.
Now, that the withdrawal from not wanting to go to school or from their friends is a result of that trauma, rather than them losing touch with reality. Whereas if you are psychotic, you've lost touch with reality. You don't want to go to the school, because obviously, depending on what experiences you're having, it may be that when you're in the school environment, you're hearing and seeing things that scare you. So there will be different reasons why people may want to stay away from school because of the psychosis. It may be that too much stimulation, your friends, when they're talking. So, I mean, listen, I'll take the time to talk about symptoms now. So when you are experiencing a psychotic...
That's the next question. Okay, that's fine.
When you're when you're experiencing a psychotic illness, the things that get impacted on, 3 areas that you absolutely need to look at is your perception. So hallucinations, people experience hallucinations. Now, hallucinations usually affect our senses, right? So our sense of touch, our sense of sight, our sense of smell, our sense of taste, and our sense of hearing. So your 5 senses does get impacted when you are experiencing a psychosis, and you do have things called hallucinations. With these hallucinations, if you look at your sense of touch, there's something called tactile hallucination. So you may well start to feel that, for example, there are ants crawling on your skin. So I can see it, you can see it, but the person experiencing it can pretty much feel it. They could potentially even have that visual hallucination and can see those ants crawling on that skin. When that happens, you and I don't see it, but this person gets distressed that sometimes people will even scratch till they bleed. So there is something there for them to react to, even though you and I can't see it. If something like that was happening to you, obviously you wouldn't want to go to school. And if it's happening when you are in school, it makes it even worse. And then the other area of symptoms is something called delusions, right? So people start to get things like paranoia. So they start to believe things that aren't real. Some of them, you know, even family members start to be, you know, they start to perceive family members as threat and don't want to be around them. So in some families, the target could be the dad. And all of a sudden, I don't want to see dad. I don't want to speak to dad, even though dad has always been in their lives. So these are some of the things that impact them in terms of having delusional thoughts and starting to believe things that aren't true or aren't real. And then there is something around disorganization in their speech or their thinking. Now, when people's are disorganized in their thought or in their speech, some of the things that you will see is sentences are not quite making sense. And then they start, in terms of the words they're using, they're associating certain words with certain things. Sometimes it could be bad, sometimes it could be good. So all of those things, sometimes people even start their sentences and not complete it. Or the way, as the word suggests, if your thoughts are disorganized, things are not coherent. So when they speak to you, I'm not quite sure what this person is trying to say. I can hear a few words, but putting what they're saying together doesn't quite make sense because the thought is disorganized and it's not quite coherent as you would. So if you're having all of these things, it's too much for you to want to be with your friends, to be at school. So the withdrawal for psychosis is different to the withdrawal from, for example, being bullied or other things.
Oh, thank you very much. So the delusion one, is it not, some people used to say you're exaggerating. Yeah, because people can misinterpret delusion as somebody exaggerating stuff. So what do you see to that? Oh, you're just exaggerating because it's so common from we African people. Because sometimes when children or anyone is just doing things, they just say, oh, this person is not serious, They just generalize the person that you're not serious or she's just exaggerating, and the person could be going through delusion.
Yeah. So the difference between exaggeration and delusion is if somebody is exaggerating, they know themselves that, listen, maybe I'm expanding on this too much, or I'm focusing on. When it's a delusion, right? The thing doesn't make sense. The belief doesn't make sense. But the person that's expressing it has something called level of conviction is the phrase that we would use to that. They have a high level of conviction that this is true. This is real. So if I am feeling paranoid, I'm having a delusion, a paranoid delusion, and I believe that somebody is poisoning me in my house. Mom, dad, siblings know there's no poison in this food. But this person 100% believes that there's poison in this food. So I'm not touching that food. I'm not eating it because somebody is poisoning me. So this is an example of a difference between this. Or somebody may make a statement, you people, you're poisoning me in this house. You can laugh about it, you can talk about it, but they'll move on from it and they'll actually eat the food. So even though they're just saying, oh, there's something in the food I don't like or doesn't taste right or whatever, by using words such as, oh, you're poisoning me and everything, could be an exaggeration of what they're thinking or feeling, but they'll still sit there and eat that food. But somebody with a delusion will absolutely not touch it because they are convinced. The level of conviction is extremely high. That tells you that, no, this is something more than an exaggeration. So yes, there are times that people will exaggerate how they're feeling, how they're thinking, but you can reason with them or they will change their position on things when you give them facts or figures or a different explanation to it. Whereas somebody with a delusion is absolutely 100% sure that this is happening, you cannot change their minds.
This delusion is a big thing because I'm just thinking let's look at it from the religious aspects now. A lot of people, they'll say they need deliverance. They said they are processed. Because I've had a lady many years ago, he rang the office and he said he needed police because there are people in his house.
Yep.
And, she was just saying so many things. And deep down within me, with my own faith, I said, oh, I think this lady needs deliverance. You understand? Because you don't call police to evil spirits. Said there are evil spirits in our house. You understand? That was what she was saying on the phone, that she needs some police to come to her house. And I said, okay, this office is not a police office, So people like that, because if they go to, let's say, a place of worship, and now they are going through that delusion, whereas it's related to psychosis, how do we help them? How do we help them that know that this thing is not about somebody's process, is that they are going through psychosis? I know all these things are so spiritual.
Yeah, well, absolutely. And I think, listen, in actual fact, having religion and faith is a huge protective factor for mental health and illness. And there's a huge body of evidence that suggests and, highlights that if somebody is going through a psychotic illness or has mental health problems, having that is protective. But equally, sometimes people's delusions are actually religious related. So it could, so typical example, I know somebody who strongly believed, and of course, you read the Bible and it says, I'm the bread of life, and I will, Jesus is the bread of life,
Mm.
and he will feed you, and, words like that. But this young person had taken this literally. And as a result of their own mental health state, believed that they don't need to eat anymore because Jesus is the bread of life and was going to feed them. Now, as you sit there as a person, if somebody has that belief and you're watching this young person literally not eating, not drinking, losing a lot of weight, they're becoming dehydrated, you know that you are in trouble. So while, it's these are words that the Bible say, you know that equally you need to physically have some food to nourish yourself and be able to carry on with your day-to-day activity. So in that instance, I mean, some of the clear guidance that we will give to people is you can do two things. Never stop praying, because even as a practitioner, some of the conversations I used to have is there's a difference between treatment and healing. Okay. So you can take as many tablets and sometimes you don't quite feel healed, but you can take tablets with prayer and feel, you know what, actually, I feel healed. So it's so, so important. And the healing also comes from the faith that we develop, that, you know what, God is going to do this for me. I'm currently going through a very difficult time with the psychosis. So family members are praying for this person, but equally, they do need sometimes the treatment, which could be in the form of therapy, tablets, whatever is prescribed. It's so important that we combine both so that, of course, if the illness has been caused by, evil spirits or devil or whatever, then you're attacking both at the same time.
Okay. Okay, that's fine. So we mentioned the 5 symptoms of psychosis.
Well, there are, listen, lots of symptoms. I think the 3 particular areas you're looking at is your hallucinations, which I've said attacks impact on our 5 senses. So you can see sometimes things that really scare you. You can hear people talking to you. And even in a psychosis, sometimes people talk directly to you. The difficulty or the hard thing about hallucinations, when people are talking to you, it can make you distracted. So if you're a young person, you can't concentrate on your learning. But sometimes the worrying thing about auditory hallucinations or hearing people's voices is when they are instructing you to do things. So there are instances where young people have been told, you know what, go and, even harm somebody. And they're hearing this, and this can be really distressing because naturally this person is not a violent person, but they're hearing this voice telling them, go and harm somebody. They're hearing a voice telling them you're not good enough. For some people, the voices are even just having a chat. So they can hear people having a conversation, but it's in their ear and they can't see these people. So there are symptoms around there that can be really scary for the person experiencing it. The delusions as well. There is the paranoia, there's grandiosity, when somebody really believes that like they are the very big person. We've had instances where people have tried to get themselves into Buckingham Palace because they believed that they were the king or queen. So there are there are symptoms that can be really, and then of course, if you end up in Buckingham Palace insisting that they open the gates for you because you are the king, you know what's going to happen. Obviously, there will be pleas, there will be arrests. So all of that can be really distressing for the person experiencing it. Sometimes with the grandiosity as well, people have ended up in a lot of debt. So I've known young people that have gone out there, literally bought cars because they're thinking I'm this rich man, and gone sign on, cars, crashed cars, because of the way that they're feeling. They're feeling invisible. Listen, I am this big person. People have jumped off buildings because they're feeling invincible. So the symptoms can be really, really, really severe in psychosis. And hence, I cannot say enough why we need to get in early and we need to support both young people. And in some instances, there are adults that experience a psychosis. There's a second peak to psychosis, and it tends to happen around the 56 year mark. So again, something for us to look out for. So even though we are talking early detection and intervention, and the fact that predominantly psychosis happen in adolescent ages, there's a second peak for psychosis, and that's around your mid-50s. So again, absolutely critical for us to look at.
Wow. That's it. I think that's why when it comes to the religion aspect, they said they need deliverance.
Well, you need the prayer. I think, listen,
Yeah.
prayer is important. So we need both. We need treatment, we need prayer, we need support. So for me, psychosis or any illness needs a full holistic support. And that means tablets, that means having your friends around, that means prayer. It means all of those things. And where possible, even trying to maintain some normality. I think the point, there's a really important point here as well. When we hear the word psychosis, straight away everybody thinks it's a mental health problem. But there are times that people will experience psychosis that's linked to neurological problems. Okay. Which are medical conditions. Sometimes tumors can cause psychosis for people depending on where that tumor is. Well, please, let's not think of psychosis as it's a mental health problem. We don't want to deal with it. We don't want to talk about it. It could be as a result of a medical or physical health condition. And so again, going back to the point, early detection, and early intervention, because the sooner we can appreciate what is causing this person to be psychotic and get the right treatment for them, the better the outcomes for them.
Wow, thank you for that. Thank you. So how can families tell the differences between normal stress and early psychosis?
Good question. So stress can cause psychosis, right? But it's very, very rare. And there's a condition which it's usually referred to as acute stress reaction. So where somebody has been so stressed that, for example, they're not sleeping. Listen, if you haven't slept for 3-4 days, your perception is distorted. You start to see, leaves on a tree, and you start to think, oh, it's a bird that's just flying about. So your perception gets distorted anyway. So if you've got the stresses added to it, if it's a stress reaction, it resolves without treatment. I mean, I've known people that have had an acute stress reaction, 24, 48 hours of good sleep. And they're completely different human beings. And they're thinking, how did I end up here? What's going on? Wow. So it's a completely strange experience. However, if you are experiencing a psychosis, a lot of the time, it doesn't just resolve itself. Having said that, there are different groupings of when people experience a psychosis. So when people experience a psychosis, they get treated. For some people, it only happens once in their whole lifetime. It never happens again. It never happens again. There is another group where they get treated. As soon as you stop the treatment, it comes back. So for those people, sometimes you maintain, you give them, you continue with the treatment, but at for example, if it's a medical treatment, you reduce your medication to the bare minimum, to something called maintenance. Okay, so you maintain them on that. And then there's a third group that even with treatment, they still experience these symptoms. And, in medical or mental health terms, they're called residual symptoms. So you've treated pretty much the bulk of it, but there's something still, hovering around. It doesn't mean those people don't function. They do, but there's always something that you almost see that they haven't returned back to the original person that they were. So even though they're better, they're carrying on with their lives, they never quite go back to where they were before the psychosis started. So stress can be a feature of psychosis, but it's not a direct correlation to developing a psychosis. There will be other factors in play, some of it being genetics as well.
Wow. There's a lot to the psychosis.
There is a lot to unpack here.
There is a lot. What about mothers that have psychosis during pregnancy or during childbirth?
Yeah, so during pregnancy, obviously, hormones are all over the place. And more often than not, if somebody has already experienced, depression or psychosis, it's a very stressful time. And sometimes people can experience, a psychotic breakdown during pregnancy. But post-birth, when people experience a depression with psychosis, there's a term called puerperal psychosis. And that, again, can be extremely distressing for mothers and families, and in some extent can actually be fairly dangerous as well, because it's a very serious condition where sometimes, as a result of the symptoms, and we've mentioned earlier some symptoms around hallucinations and delusions, and for some mothers the delusions are such that they believe that that the baby is not even theirs.
Wow.
And I have known people that, as a result of their delusions and the distress that it's causing them, have wanted to put the babies in a bin because that baby doesn't belong to them. Some people have seen these babies as aliens or demon possessed. And there are instances where, mothers have even had boys and said, no, I actually had a girl. Why have I been given a boy?
Wow.
And yeah, so there are some real distressing situations where mothers are going through puerperal psychosis. It can be extremely distressing for partners, for other members of the family, and for the mother themselves, because imagine having these experiences. It's extremely distressful, and which is why in England there are units called mother and baby unit, so that mothers who are experiencing postpartum or puerperal psychosis can go into these units while they recover and have extreme and have treatment and supervision from trained professionals to ensure that they maintain their safety, maintain the safety of the babies until such time when they are able to, when the treatment is effective for them and they're able to take care of the babies themselves.
Wow. I thought the reason why people throw away their baby, some people, not everybody, is because maybe they don't have the finance, or the husband said, if you have boy again or you have girls again, don't come to my house. So I don't know, it could be something deeper than that.
Oh, yes. No, there are all sorts of reasons why people do that, which is why, again, in our earlier conversation, it's understanding what's natural for this person and what's not. Now, somebody with usually with a puerperal psychosis would have been looking forward to the birth, and then all of a sudden baby arrives, they're struggling to bond with the baby, and then they're having difficulties with their mood, with their perception and all of that. And then you see things changing over time to the point where, you've got a full-blown psychosis that impact on your actions and what you do. Whereas, where people have social situations that impact on them actively making decisions about, actually, I'm going to just put this baby here and hope that somebody finds them and gives them the care they need. More often than not, if somebody is experiencing puerperal psychosis, they tend not to actively make those choices or decisions. Even if they do, it may be as a result of the hallucination that's saying, listen, leave that child here. So there are things. So there is something called command hallucinations, where you're being commanded to do things. And as far as this person is concerned, because they've lost touch with reality, they believe that those commands to be true, because they believe that if they don't do it, there would be consequences, and the consequences won't be positive. So they act on those commands.
Wow. Thank you for sharing that. Thank you very much. So what kind of conduct do people commonly overlook but hold significant importance?
Absolutely. So you are with your listen, we all usually say teenage boys, teenage girls, they want to stay by themselves, they don't speak much, or the rest and the rest. That's absolutely fine. I think for me, friends and family around young people, and even older people, adults, what you are looking for is difference. Okay. So has there been a change in this person that I know? Has there been a change for, positive, for negative? So you will see changes. So look out for the changes. It's not so much around, if the normal person is to be quiet, is to be, keeping themselves to themselves. Some of us, listen, we like to be chatty. Not everybody is chatty. So, for example, I am a chatty woman. I am, I am a lot of the time very, bubbly.
Yeah.
And so if I start to go really quiet, straight away somebody's going, are you okay? Because you're not your bubbly, happy self.
Yeah.
Right? But if I am a quiet person, then all of a sudden I'm going about being really bubbly, really excited, behaving in a very unusual way. People are thinking, hang on a minute, what's going on here? So what you're looking for is difference. What's changed? So changes, first of all, from the usual for that person or for the norm for that person. The second thing you're looking for is how long it's lasted for. Okay, because listen, when we're all happy, we exhibit different behaviors and our mood is different when we're all sad, but it usually doesn't last. It might just be today, some good news, I'm flying off the wall, even if I'm a quiet person, because, there's good news, I'm behaving differently. I'm so happy because it might be something that I wanted. Let's not go around saying everybody's gone psychotic because they're happy today. No, absolutely not. What we're saying is look out for the changes, look out for how long it's lasted. Now, the third thing you want to look out for is how it's impacting this person in terms of the level of distress or the function, right? So where people can't function because of the changes that are going on, or you can see a slight drop in their functioning, you need to be concerned about it. So, for example, you've got this child that's always been an A-star student. And then all of a sudden, within a space of a month or two, the assignments that are coming back is dropping to a B. Hang on a minute, what's going on here? So if there aren't clear academic reasons why that's dropping, you need to start looking at it. And you don't just look at it in isolation, look at it in terms of the mood, their behavior, and other things. But also, if the person is feeling really distressed by what's going on, and it's like they're getting really upset by the fact that I don't feel something is quite right, my grades are dropping, I can't really hang out with my friends because I get really anxious. So there are a number of things, but if you do nothing, look out for the changes, look out for how long it's lasted for, look at whether there are any drop in functioning or the distress that the young person has. And then you think, with all of that together, absolutely, you need to do something about it.
Wow. I'm thinking of a question now. Anyway, you mentioned everything, because I'm just trying to say that sometimes when people are bubbling and some people start withdrawing now, maybe I'm a bubbling person now and I start withdrawing now, it could be maybe the person has been hurt. So sometimes I do understand that you need to look at the how long for, and the duration. That's fine, because some people are bubbling person like us, isn't it?
Yeah, but
I know, because people have altered or did something that is not nice or offended them, and they just start withdrawing,
Absolutely. So withdrawing in itself, it's not an issue. As I said, I can withdraw for a day, 2 days, even a week. That's absolutely fine. But am I still going to work? Absolutely, I'm going to work. When I go to work, can I concentrate on what I'm doing and be able to produce the same level of output and result? Absolutely, yes. Then I don't need to worry about this person. But when the person is withdrawing, all of a sudden you speak to them, concentration is not there, it's their sleep is disturbed. So all sorts of symptoms are starting to come together. It starts to impact on their functioning. I mean, if you're not sleeping, you can't concentrate. It is only natural that if you are a student, it starts to impact on your grades. If you are a worker, it starts to impact on your output. Now, we have various ways of assessing this, and there is a particular tool that is used. And the key significant one will say that if somebody's global assessment of functioning drops by 30%, especially when there's a family history of psychosis or psychotic illness, that's a red flag. That's an absolute red flag. Because, and while everybody can go around doing a global assessment of functioning, as families and friends, we could pretty much do that. like the grades. So from A star to B or C, that is huge. That is almost 30% of, the person's performance, from somebody that would wake up and have a shower to somebody that hasn't had a shower for 3 days. Come on. So it's those key little things, but key and critical for this person is what you start to look out for.
Wow. Okay, let's move. I don't want to dig deep with that because I've had some people, they say it's not even good to be bathing every day. I say from where?
So if it's the person's wrong.
Yeah, exactly. So anyway, it might not be psychotic because they said the more you bath, the more the oil in your skin is washing off. I say, I don't know. Let's just move on. So why do many people delay seeking help?
So there are a number of reasons why people delay seeking help. As I said, a lot of psychosis don't happen overnight. Okay. So a lot of it has a period, could last between weeks or years. Now that period is called the prodromal phase. Now the prodromal phase is very difficult sometimes to actually detect. So it could be quite subtle. And again, depending on the person's characteristics, sometimes when people are very much aware of what's going on and the fact that something is not right, they find ways to compensate and they find ways to do things to hide it or cover it up. So they can explain away. So when you sometimes point out to them that, I've noticed this and I'm not quite sure what's going on here, they'll find an explanation for you, which means that it's so difficult for you to detect it. But you know that something is not quite right, but it's not big enough for you to be able to say, nope, there's something definitely wrong. So in that phase, it's so difficult sometimes for family and friends and for even the individual to seek help because it's not quite clear. They're still functioning to a good extent. So things are left there. And then there is also the thinking around the stigma. So stigma is a huge thing, especially in specific communities, right? So in certain Asian communities, because marriages go through families introducing families, more often than not, there are conversations around, if anybody in the community knows that we've got a child with mental health problems, nobody would want to marry from the family, or the men in the family can't go and get married anyway. So we don't want this. So we'll keep it contained for as long as we can. And then there is the issue around sometimes the symptoms can, in some respects, sometimes people interpret those symptoms as, what do you call a spiritual attack or the devil doing something. And so we probably spend a longer time praying rather than seeking help alongside the prayer to make sure that this person is getting the treatment they need. So there's so many reasons why people delay treatment. The other reason is when family members or communities have already had experiences with services, so services as in health services, or in some instances where there's been experience within a family or a community where somebody has become so unwell that the police have had to be involved and everything else, people can become a little bit wary of services and said, oh my goodness, when so-and-so's son was unwell, they had all the police over the place and this, that, and the other, and the trauma of it. So when somebody else is unwell, it's like, no, we're not going down that route. I don't want the police here putting my child down and being aggressive to them and everything else. So there's so many reasons why people don't seek help early. And sometimes people are in almost denial, saying it's going to go away.
True. Yeah. Well done. That's a good one. So what does early interventions look like in a real life?
In real life, listen, if you think something is not right with this child, this adult, the first thing you do is go and see your GP.
Okay.
Right. Now, if you go and see your GP, they'll do an assessment. They've got various ways of assessing. So there are standardized templates. For example, if they suspect that you have a depressive illness, they'll do a depression assessment. They'll ask you lots and lots of questions, and then they'll look at the outputs from those questions and say, actually, there might be some depression here. Equally, if people are experiencing something more than a depression or anxiety, they would be able to pick that up. Now, in England, in 2015, there was an introduction of a policy that said if a GP suspects that anybody is suffering from a psychosis, they have a duty to refer to a specialist mental health team or professional within 2 weeks.
Wow.
Within 2 weeks, you need to be seen by a specialist mental health professional. Now, why did this even policy came about? Again, it's very much speaking to the agenda of early detection and early intervention, because we know that if you intervene early, the prognosis and the outcomes and the trajectory is a lot better. And believe you me, I have worked with lots and lots of young people who have gone on to get their degrees, to have a very fulfilling life by getting in early. So these are, once you see a specialist mental health service, again, you can have the discussions and they'll look at the various treatment options, including talking therapies. So not every illness results in you being on medication for life, or, depending on what is caused it and what you need to have. But I always say, go there with an open mind. And if you need tablets, again, I've heard people from our community going, oh, these mental health tablets, they actually mess up with your brain. No, they don't. I have seen young people get fully treated and have done well. So we need to go in with an open mind. And as I said earlier, pray alongside that so that this child, this young person, this adult, mom, dad, whoever it is, gets the healing they need.
Wow, that's a good one. Yeah, it's true. I think that's the mentality of so many people, though, that when they take the all this mental health, depression, stress, anxiety, that it affects their brain, and once they are on it for a longer time, it's dangerous.
Yes. So this is where, again, within services, you need to make sure that you are monitoring it. Another point that I probably should have mentioned in terms of why sometimes people refrain from seeking help is the fact that it will go on their records and it will have implications for future job prospects or listen, nowadays, our universities, I work with a lot of universities. Our universities, there's a real indication that the need for mental health and well-being services is going up. So all universities have mental health and well-being services. I've worked with quite a lot of them in different capacities, where I was going into universities to work with these mental health and well-being practitioners to support them in early detection of psychosis. So there's a lot of work and money invested in those areas to ensure that if people are coming to uni, they can actually be supported to complete their degrees. And I've worked as a university mentor before, where I support a student with serious mental health problems to get through their degree, and they have done well. Listen, I've seen people who have suffered severe psychosis come out with a 2-1.
Wow.
So for me, it's, yes, it may well be on a record, but if you don't seek that treatment, you don't get the outcomes that you need. So absolutely, we need to look at it. But there are services out there. It depends on the local area that you live in, but your first point of call is your GP. Absolutely speak to, pastors, friends of church and everything else to pray for you as well whilst you seek those treatment. But please, first point of call, go to your GP.
That's a good one. Thank you for sharing that. Yeah. Our next question is, what is the potential time frame for treatment to make a difference in a person's future direction?
So I'm not going to put some times around it. And the reason why not is everybody is different. What I can say is, as soon as you notice that there is a problem, please seek help. So it could be days. If you notice there's a problem in days, seek help. Now, there's so many reasons why, apart from the fact that you want your young person or the adult or whoever it is to get the treatment and get on with their life. What's happened as well in the past is when people suffer a psychotic illness, for some people, depending on what the symptoms are, have actually ended up committing crime. And when that happens, as you rightly said, your whole life trajectory is changed forever. absolutely change forever. So I think for me, as soon as you detect something is wrong, get in there early, whatever treatment, whatever support, just get that. It could be from days, it could be, but as soon as you notice that change, as soon as you notice that change, it's so, so important. As soon as, this person is telling you, actually, there are people that, sometimes will actually say, you know what, I think there's something wrong with me because I'm hearing voices and I'm seeing things. So they will be very vocal about it. But that is easy because you know that I need to seek help now. But where people do not tell you what they're experiencing, then you're going to have to be clear about, I've noticed the change. It's lasted long enough. I can see that this person is not functioning as they used to. And I can see that, they're getting distressed by it because people sometimes get really upset by what they're seeing and what they're hearing, all the psychotic symptoms. So please, as soon as you notice anything, get in there early.
Wonderful. So I know we mentioned a little bit when we talk about the early signs and why do people don't want to, to put it out there that they are going through this stuff. So how does stigma affect early detection?
So listen, we all talk about, I don't want my community to know. We all have all sorts. I mean, from the areas that we come from, or even in England, people have different names for people who have mental health problems. Right. So first of all, and I cannot say this enough, no, mental health problems is no respecter of persons. Okay, so there are people that have money, that have education, that have everything you possibly could ask for, and be Christians and suffer mental health problems.
Yeah.
And there could be people that are poor, that have no education, not Christian, and suffer. So mental health problems is no respecter of persons. As I said, it's a continuum.
Yes. Yeah.
And there's a health side that literally we all have stresses. Today I feel really stressed. I have a good night's sleep. You know what? Tomorrow is another day. I'm back. And then it gets to a point where it shifts you into the illness section of the continuum, where you might need some counseling, you might need some help. And if you don't address it and it goes on, you end up right at the end of it. It is no respecter of person. So we just need to, in some respect, normalize it as much as we normalize physical health problems. Now, if you have a broken leg, would you stay at home and say, oh, somebody's going to see me with POP? No.
No.
So why is it that when we have a break in our brain, I mean, mental health tends to affect, the top part of our body, but it's all our body. Okay, so for me, it's head to toe. If we think about our whole body, then when there is a break in my arm, if I'm going to go and get POP, why would I not go and get medication, treatment, whatever, when there's a break in my head? I'm going to do exactly that. I'm going to do exactly that. So if we start to move away from seeing mental health as this other thing or this other health problem that people don't like, or that it's a negative thing, and see it as this is part of my health. Mental, physical, they're all part of my health. So if I have difficulties with my mental health, I'll seek help. If I have difficulties with my physical health, I'll seek help. I will stay at home with a broken leg. So I'm not going to stay at home with a broken brain. I'm not doing that. That's where we need to get to. And then the stigma will sort itself out, because you know what? There are so many. If you look at depression, 1 in 4 people suffer from depression. 1 in 4. That's huge.
That's
So if you go into any room and there are 12 people, you be sure that at least 3 out of the 12 have depression. Okay. So why aren't we talking more about it? For me, it's our whole bodies. We should be taking care of our whole bodies. Our bodies are the temple of God. We need to be taking care of it. So as much as we take care of our physical health, we should be taking care of our mental health. Then we can start to reduce the stigma if we did that, because then it's not a big deal. It doesn't become a big issue. And then people can, start to talk a bit more about it and reduce the stigma that comes with mental health.
You're very right, because people talk about stigma. And as I said earlier on in our discussion, that's why I like this generation. They don't hide anything. So, because even when you are looking at this stigma, what majority of people are going through is even more than what that person is going through. But because they are not voicing it out, you're voicing it out, and now because people are voicing things out, so they have people start coming up now. They have that boldness to talk about what they are going through. Unlike in our own time, whereby say, "Oh, you're going to tell everybody, everybody's just going to be looking at you. They're just going to be looking at you." But now, the whole world can know everything.
Well, that's true. I mean,
exactly.
We've got social media to thank for it.
Exactly. The other day, the king was ill, isn't it? Everybody know what is wrong with the king. So what's there is true, and people are going through more issue than even the little things that people are saying. Oh, they want people to know about it. That's fine. Anyway, thank you for all these insights. What roles can teachers and peers play in noticing early stigma? Early signs.
Well, so I have talked extensively about the various signs, right? Now, when I worked as a practitioner, some of the things that I did was something called the brain MOT. And we used to go into PHSC lessons to talk about the brain MOT with young people, and to really start to talk about their mental health needs. And sometimes it's very difficult for teachers to be able to pick up on all of those things. Remember, when your children are young, and by the way, PHSC lessons, if you are not somebody that have children in school, or have children, your children have been to school a very long time ago, is a personal, social health, and economic education. So usually when in those discussions, the PHSC lessons, as we've said, you've heard the personal, social, and there's health in there. So there are discussions around people maintaining their health and well-being. Those are opportunities for teachers to talk to their learners and students about health and well-being. Now, when we did our brain MOT sessions, it was very much going there and asking some of the three things that, the indicators that I shared earlier on. Are you still performing at the same level that you were performing at school over the past year? Are you experiencing something unusual for you? Like, hearing voices. So we only asked 3 or 4 questions, right? How long has it gone on for you? And does it bother you? Does it distress you? And if you've said yes, yes, yes to all of that, we then say to you, listen, go and speak to your GP. So teachers can literally bear those 4 things in mind, or people around us. So not just our teachers, Sunday school teachers, pastors, everybody, they can literally be doing this on a regular basis, where you can see a change in somebody. Say, hang on a minute, sister, brother, I've noticed the change in you, young man, young woman. I've noticed a slight change. You are not coming to, youth service as much. And when you come, you're quiet, you're not contributing anymore. Is everything all right? If they're open to sharing with you, I haven't really quite felt very well, I'm feeling slightly anxious about something. Where there are concrete things that's impacting their mental health, of course, they can be supported with the right input. Where they're talking about things that seem like a psychosis, you can then encourage them to go and see their GP as soon as possible. In some instances, young people have even said, can you please come with me? Or I'll speak to my mom to go with me. Or so it's sometimes people have even preferred to go with their teachers. So it's that opening up the conversation and continually saying, listen, it's okay to talk about mental health. So we all have a role to play, because your children sometimes are home when you are at work, or you leave in the morning before they go to school. So they're spending 7 to 8 hours, in some instances longer, with those teachers as well. So those teachers know the children, and sometimes they can see the difference, because when you're too close to somebody, sometimes you don't actually see it until it happens, and you think, why didn't I pick up on this?
True.
And then you start to feel guilty and everything else. It's okay, because sometimes the timing is such that, and as I said, some young people are so smart, they'll hide things. And so you pretty much are depending on other people that spend so much time with that child to be able to identify changes and what's going on for them. So everybody has a role to play.
Wow. How can communities create safer spaces for people to speak up?
Community. So again, I'm going to examples of what we used to do. For example, I worked in town hamlets for, pretty much all my career. which my clinical career. And some of the work we did was speak to, for example, imams to say, listen, when people are not feeling well, or sometimes when things are going badly, they will come to you first. They don't necessarily go to GP. So these are the sort of things that we want you to look out for if people come to you. Obviously, if they've got other problems or issues that needs to be dealt with through, community counseling and things that you can speak to them about, fantastic. But if these are the things that are happening to them, then we want you to support us in detecting early and intervening early by telling them to come and see us. Some communities have a lot of respect for their elders, community elders. And so what we tend to do is actually, they may not listen to me, but at least they'll listen to that elder at church, elder in the mosque, or, the youth club they go to. So we make sure that they're all well equipped, and we work very closely with them to make sure that where they have concerns, they're supporting and directing people to come into services. So, you can definitely work with communities, because in the end, people tend to trust the communities they're in, sometimes a lot more than they trust statutory services. So that's the only way you can get people coming to you.
Wow, that's a good one. What are the myths about psychosis makes early intervention harder?
So the myth is, I've mentioned some of them, that, you go and see these people, they'll give you drugs that spoils your brain, you won't be able to function, you start becoming, so those are some of the myths. There are myths about sometimes psychosis just being, what do you call it, demon possession, or in some cultures, like evil eye is just looked at you. In some, cultures, it's actually there's a spiritual attack. So those are some of the myths that actually every psychosis is caused by something other than the chemical imbalance in our brain. And sometimes it could be that. Let's not forget, in some families, there's a genetic predisposition, right? So if you've got first relatives that are, like mother, father, brother, sister, your risk is higher anyway. Your risk is higher. So if there's a history of it within the family, you look out for it. I'm not saying you sit there and constantly get yourself anxious, oh, is it going to happen to me or whatever? But it means that when things aren't going well, you just need to make sure that it's on your radar to think about. So the myth that, oh, it's happened to this person, it can't happen to me. Well, I'm a very outstanding member of the community and I worship God every Sunday and all of that. So, oh, it can't. So sometimes it's that myth that it happens to people who are bad, or it happens to people who are not Christians, or it happens to specific people. It's a myth. It could happen to anybody. It could absolutely happen to anybody. Yeah.
Wow. But what about if it's not in a family and it just happened to you like that?
So that's a possibility. That's what I'm saying. So if there's a family history, it just means there's a higher risk. But equally, it could happen at any generation to anybody. It really, this is the myth that, oh, it has to be in the family, or you have to be a certain type of person, or you have to be using drugs. There are people that have never smoked, never drunk, and they get a psychosis. Equally, there are people that drink every night, smoke cannabis every day. They're fine. They're absolutely fine. For some young people, and we haven't spoken at all about drugs, but since I mentioned it, for some young people, actually taking things like cannabis and other drugs can end up giving them a psychosis. So there is another term for us, which we would use as drug-induced psychosis.
Okay.
So for some people, once the drugs are out of their system, psychosis is gone. But again, I remember one of my consultants used to say, it's like peanuts. If you're allergic to peanuts, why would you eat it? You don't go eating peanuts. So if you're a young person that's ever used, cannabis or any drug and realize that it's giving you a psychosis, you never touch it again, because you know that you are allergic to it. In other instances, when people are experiencing those horrible symptoms, sometimes they use drugs and alcohol to mask the symptoms, or almost as a self-treatment. Because, sorry, when I take it, I then, feel relaxed, or, but it doesn't last. It doesn't last. Things like alcohol, it's a depressant. So even though it makes you feel good right now, actually you feel worse in the morning. It's a depressant. So it's looking at how sometimes we manage all of those things. So yeah, really, really important for us to really think about the management and how we look at these things.
Okay. So with somebody suffering with psychosis, yeah, is it okay for them to go counseling? Because like people that suffer for stress, anxiety, they go for counseling. So is counseling part of healing or pathway to healing for psychosis?
Absolutely. Everything it's a combination of different interventions and treatment that comes together to get the person back on track. Now, when somebody suffered a psychosis, sometimes it can impact on their self-esteem significantly. And it can cause people to become even depressed sometimes, like the sadness of, oh my God, I had everything going for me. I was going for my first class, or I was going for a promotion at work, whatever it is. And then all of a sudden I've been ill and it sent me back a whole year, or I no longer can, do the things I wanted to do or achieve the grade. It can be extremely sad for some people. So again, as part of the treatment, you do sometimes, well, a lot of the time get psychological treatment alongside that. Now, there is a guidance in UK, which is called the National Institute of National Institute of Health and Care Clinical Excellence. Now, the guidelines from the National Institute of Health and Care Excellence does outline specific intervention that's evidence-based for somebody who has suffered a psychosis to get better. Now, those recommendations include things like family intervention, behavioral therapy. So cognitive behavioral therapy, it looks at the person's physical health, it looks at their social or, educational needs. So it is holistic in the way that it talks about spiritual needs. So it is very holistic in the way that it presents to be able to get everything together for this person. So it's not just take the tablet, off you go. There are all sorts of other interventions that you will have. Let's not forget, psychosis can impact not just on the person, but their families and communities, and hence things like family intervention to see how that's impacted the whole family. Can families look at communicating differently to support this person? There's so many interventions out there.
Wonderful. Thank you so much. So what is the most important message you want the audience to remember to early psychosis, and what would that be?
I think I'll go for 3 key things.
Okay.
So my first thing is, let's appreciate that mental health problems, psychosis, it could happen to anybody. It could happen to anybody. And so absolutely, let's not think it's happening there, not here. So being really mindful about the fact that it could happen to anybody. The second point I will make is, when you notice, as earliest as you notice the change and the impact on your loved one or your friend or whoever, please seek help. There is so much help out there. Seek help as early as possible. Now, I'm not saying seek help just in, going to doctors and everything. I'm saying seek holistic help in speaking to pastors, while you speak to doctors, while you speak to friends, to get the social support, while you speak to community. So seek holistic help. Now, the third point that I will make whilst you seek all of this help is be open-minded about the treatment, but more importantly, advocate. Okay, so sometimes healthcare can offer things. Sometimes, as they're offering, you you know your family members best, you know the people around you best. Sometimes it's really, really important that you work with healthcare professionals to make sure you get the right support and treatment for that loved one, for that individual, because it's not just up to healthcare professionals to determine what's, you know, what's good for this person. And sometimes the advocacy is so important to ensure that the person goes to appointment on time, the person is supported in the various therapies, if it's family therapy. So you being there as a parent, advocating for, can somebody please help this child with their occupational needs, education needs, training needs. So it's so important that there is that advocacy. But please, whatever you do, seek help early.
Wow, thank you so much. Thank you for all the insight. Thank you for providing this valuable perspective today. Information highlights a critical fact. Early psychosis detection and treatment can change life, bringing hope and a better future. We can help people and families through this with dignity and strength, by raising awareness. My guest has said it all, and lessen the stigma and make sure care is available. Let this conversation be a reminder that mental health is everyone's responsibility. And together we can build a community where early support makes all the difference. Thank you so much, Henrietta, for your time today. Thank you. And thank you for honoring this call. And that is that for us now, all our audience. Bye for now.
Thank you so much for having me.
You're welcome. Thank you.